This conference will now be recorded.
And we're also reinventing how we operate in our daily lives. With me in the room today are members of the RWJ Hamilton senior team, some members of our board of directors, and also we have a number of our board of directors on the video call as well. As many of the restrictions that were put in place since March are being slowly lifted, we want you to know that we are ready to serve your healthcare needs. Our Hamilton Hospital and the RWJBarnabas Health System have been working diligently to make sure that we can return or bring our patients back safely and welcome the community back in a safe and efficient manner. So whether you're being admitted for a procedure, whether you're out here for outpatient services or you're just visiting, the first thing you'll notice is some new thermal recording equipment at every entrance of the hospital. We'll make sure that every one of our visitors and everyone entering the room or entering the building rather, will have their temperature checked. In addition to that, our employees have all the necessary PPE that they need to protect themselves and protect you while you are here for your visit. In addition to that, because of our agreement and our partnership with Rutgers Health, all of the physicians and all of our staff have been tested. In addition to the extensive environmental cleaning protocols that we use, we're also using ultraviolet light disinfection process called TrueD, which is a leading edge disinfection system offering leading edge technology that we have been employing for quite some time here at the hospital. These ultraviolet robots actually disinfect and sanitize all the safer surfaces that people come in contact with. So they help ensure that we are providing the safest possible environment we can for our patients and our employees and the physicians as well. And thanks to generous contributions from the community, we are about to purchase our third TrueD machine and put that into service. And before we begin, I'd really like to take this opportunity to acknowledge this team here at RWJ Hamilton and their commitment to our community. I'm really proud to be involved with this organization. I can't tell you how proud I am. The level of commitment, the compassion, the sense of caring that these folks exhibit every single day, they really set examples that inspire all of us to not only do better, but to be better people. I'd also like to mention the very supportive community that we live in, from Hamilton Township to Robbinsville to East Windsor, all the restaurants, the local businesses, the frontline workers, all of them, while they're fighting their own battles with this pandemic, have come together to support RWJ Hamilton in an amazing way. So we should all take great pride that we can live and work in this community that is so supportive to all of us. So thank you all for that. And with that, I'd like to turn it over to Richard Freeman, who is the President and Chief Executive Officer of the hospital, who will give you an update on where we stand from 2019, as well as an update up through the balance of this year. Thank you. Richard.
Good morning, everyone, and it's a privilege to be here today to share the news about RWJ Hamilton and the state of our organization. RWJ maintains a strong commitment to this community. In fact, everything we do is driven by community needs. Thank you, Bill. I am pleased to have the opportunity to share recent news about RWJ Hamilton and about the strong commitment we have to the community. Just to talk a little bit about the system, we are the largest healthcare system in the state of New Jersey with coverage of about 5 million residents, part of the RWJBarnabas Health System. And it's not just the size that makes our merger and this organization special, it's the prospect for the future. The expansion of care that we're able to offer our community now is beyond what is able to be done through any other system in our community. Most of you know us as an acute care hospital, but we are more than just an acute care hospital. We're also a mini system in itself in the region. 49 years old this year, started in 1971 as Hamilton General. We've matured well beyond the vision of our forefathers. We are not just an acute care hospital, as I mentioned. We are also part of the the Rutgers Cancer Institute of New Jersey. And we have the newly enhanced, upgraded Cancer Center affiliated with Rutgers, and it's a designated NCI Comprehensive Cancer Center, which means our patients know that the quality care they receive is among the top in the nation. We have over 24 providers practicing at RWJ Medical Associates and our specialty practices. We have centers of excellence in orthopedics and spine health, in neurosciences, certified stroke, occupational and corporate medicine, and we are the largest provider of physical therapy and rehab services in our community. RWJ also operates today with not just a site of acute care, but also making sure our community stays well. And in fact, the setting that we're in today is a medically based fitness center that houses about 9,000 members, a conference center, and a robust community center, as well as a thriving rehab program that I mentioned earlier. We also have we also are one of the largest providers of daycare in our community. Just so you know, during the pandemic, we stayed open for our essential workers and frontline workers, and we offered care to those people so that they can take care of the community. The daycare centers currently were originally scheduled to just take care of kids from age 6 weeks to 6 years, and we've expanded that now to 13 years old, and so that folks who have to go to work or are allowed to go to work can drop their kids off and still be assured that they're getting the safest care for their children. And so I'm very proud of the work that our Lakeview Daycare Center has done during this pandemic. We are laser focused on quality and making sure that our patient experiences are at the top of our list. What we'll be talking about today is our quality, our new programs and services, our modeling and leading in diversity, as well as our focus on meeting community needs. There are important recognitions that we want to talk about that really are focused on quality, and I really am very, very proud of some of the excellent recognition that we've received over the past year. And these are things that when we started this journey for quality a few years back, we were hopeful that we can hit these numbers, but we've surpassed them. And if you look at where we are now, we are one of the leading hospitals in the entire country in terms of quality and recognition of excellence. And in fact, we just received our 10th hospital safety grade A by Leapfrog this past quarter. And we again have been named one of the top hospitals by Leapfrog in 2019 in the entire country. And we've been recognized by the US News and World Report as a top performing hospital in 2020. And of course, we continue our designation with the NCI Comprehensive Cancer Care Center. And then recently, we've been upgraded in an elite status to a 4-star CMS Medicare rating, which is very, very exciting for us. We were a 3-star last year, and this year we just became a 4-star. That's one of the top ratings in the entire state and in the entire country. So we'd be very proud of that. And we've been recently certified by the Bariatric Center of Excellence. The only way that we can really get to this quality is through our work towards becoming a highly reliable organization, or an HMO. And what you see here is the big picture of how we provide care and even safer care to our patients. It's woven into the fabric of our hospital. Organizations that operate under trying conditions all the time, yet manage to continue to reduce incidents and potential harm to its patients, are considered high reliable organizations. As part of our commitment to quality and excellence, our staff is taking a journey to ensure that Robert Wood Johnson Hamilton is an HRO, providing the best in patient and family experience, and medical care. When you look at some of the indicators that sort of show us where we are from quality, you can see that we are, again, one of the top hospitals in the entire country as it relates to quality outcomes. We are also committed to our nursing excellence. We have been on a journey to become a magnet hospital since I started with the organization 6 years ago, and I'm proud to say that we are hopeful by 2021 we will be designated as a nursing magnet hospital. We are continuing our safety, and as Bill mentioned, it's always our top priority, and we've invested in safety with the additional purchase of a second TruDi robot and a third one on order to make sure that we are not just doing our terminal cleaning and have a safe environment for our patients, but we are truly going above and beyond every day to make sure that we have a clean, safe environment for our patients, our employees, our physicians, and our community. We also have a valuable tool to improve the patient experience in our Patient and Advisory Council, or PFAC. It's an organization we have committed to bringing patients and families into our decision-making and support process to support safety, quality, and experiencing, again, advancing and elevating our Safety Together transformation. These are folks who are part of the hospital, who have been either patients, family members, community members, who really want to have a say in how we treat our patients and how we go through the process of taking care of our patients. And they've been very valuable to us in guiding us and helping us make sure that that experience is positive. Wanted to also mention just the numbers of patients we see in our community. And I think it's telling to say that we are vital to the community as it relates to our outpatient visits, 103,000 outpatient visits, clinic visits, and treatment visits a year. We have, just in our primary care sites, we have over 35,000 primary care visits a year at our hospital. Around 37,000 emergency room visits come through our door every year. We do over 5,000 surgeries at our hospital and about 7,000 admissions every year. So you can see that Robert Wood Johnson Hamilton is a vital part of this community, making sure that when you are sick, we're here to take care of you. Talk a little bit about the community impact. We are the largest employer in the township. Our occupational and corporate health department provides services to more than 300 employers, including state and New York, Jersey, Mercer County, Hamilton County. And during the pandemic, we were actually the testing site for multiple municipalities, including Hamilton, to make sure that our frontline first responders were kept safe. And so we were doing COVID testing and drive-through COVID testing at our primary care express site during the pandemic. And we were able to provide rapid turnaround, 24-hour turnaround, to make sure that we can keep the police, fire departments, EMS on the road and taking care of you out in the community. Many times people talk about teaching hospitals, and sometimes they say, well, you're not a teaching hospital, but I just want to just sort of inform you that we actually are a teaching hospital. We might not have medical school residents, medical student residents, but we do have affiliations and do teaching with 13 colleges and universities throughout our community. We provide things like residency programs for nurses, for physical therapy, for radiology therapy, for laboratory, for a number of various ancillary and support services to make sure that we are training our future providers of healthcare for this community to keep us safe. We have 388 hospital volunteers providing a total of almost 42,000 hours worth of voluntary commitment to our hospital last year. Unfortunately, during the pandemic, we had to eliminate or slow down or stop some of the voluntary work that we did, but I'm happy to say that starting today, our volunteers are going to be coming back to the hospital, and we are allowing volunteers to start working and being seen and doing their jobs that they love to do, and we love to have them at the hospital. I want to welcome our new physicians who have started at our hospital over the past year. Some of the physicians, we have a number of physicians who applied for staff and have our own staff, but some of the highlighted physicians I wanted to mention. We have Zach Hakma, who is now the Chief of Neurosurgery Spine at our hospital. Dr. Mark Levine has joined us and is seeing patients will be seeing patients in our hospital as Director of Orthopedic Spine. Dr. Sadik, who is a world-renowned bariatric surgeon, certified, and he has started doing work at our hospital, and he is going to be developing and building our weight loss program. Dr. Sarah Ali in geriatrics. We have a geriatrician who specializes, who's seeing patients at Primary Care Express and helping to grow our geriatric program. We have Kanali Talil, who is specialized in GYN, a female GYN physician who works in the Robbinsville office, who just opened in February and is just starting to do work in our hospital. Marcella Franks, who's actually been part of the community for a number of years, who's joined us recently to really help build and develop our sleep center program and our sleep studies. Marcella, Dr. Frank, is really well known for her specialty and really has made a huge difference in our service levels and our knowledge of sleep studies in our hospital. Dr. Louis Sarujas started with us very recently. He is coming from Lawrenceville. He's a native of Hamilton, and he is a primary care physician, and so it added another primary care site in our Lawrenceville location. From other folks who started with us most recently, Carol Doherty, who is just employed last 2 months or so ago. She is she is the holistic navigator at our cancer center to really help navigate our cancer patients through the integrative care that we offer at the hospital. I'm very excited about that program and our differentiation that we have as not only a leading technological and clinical leader in cutting edge cancer treatments, but also our holistic approach. And so she will help those patients navigate that holistic approach. Joyce Canalese is our manager of the Better Health Program. The Better Health Program is a senior program that we're starting this fall, and we kick it off. It's a free wellness membership program for adults age 65 plus, which offer programs and events, resources, expertise to help them live a healthier life. And she will be working with Dr. Ali, and they will bring together a fantastic program that I am very excited about. If you really look at the demographics of Hamilton and you look at the community, we have an aging community, so it's critical that we make sure that our seniors live a full and experienced life, and this program will help with that. The other thing that I wanted to mention is we also renovated our cancer center with a donation from the Syed family. The Syed Family Infusion Center now is a state-of-the-art infusion center providing the utmost comfort in safety and during treatment. And so excited about the new renovation to our infusion center as well. It's a beautiful center. Our Connect Physical Therapy, as I mentioned earlier, we are one of the largest, if not the largest, provider of physical therapy and rehab medicine in our county. And we just added another site for Hamilton and Howe with the acquisition of Connect Physical Therapy becoming part of our family. Congratulations to them. We did open up another primary care site in Robbinsville. And so that's opened, I think, in November of last year. And so Dr. Shankar Santhanam is staffing it, and he is seeing patients there now, very busy, and it's a very successful and another primary care locations. We have a number of locations that we will be opening over the next few months. And Kathy Jansen is our Chinese navigator who has worked with our community to bring the Chinese community into our hospital. It's only 2 years old, and she's already have brought over 900 patients in 2019 to our hospital, and it's providing Chinese-speaking patients and bring navigation as well as translation to our hospital. So welcome, Kathy. Over the next year, I just wanted to mention a couple programs that we will be developing. One is the Growth in Orthopedic and Spine Center. We'll be focusing on that and excited about our certification, one of the only hospitals in the community that are certified by Joint Commission for Orthopedics and Spine. We will be adding additional primary care sites. We will be opening up in Pennington next year. And we are enhancing our neuroscience program with the addition of the GNI group and building that program up as well as their spine program, the neurospine program. And again, I mentioned expanding our weight loss and bariatric program. I'm excited all these new programs that are going to bring much needed services to our community. Very proud of our staff to create a safe and understanding space to work. These efforts translate to the creation of a safe place to receive care also. This year, our employees established a diversity and inclusion council comprised of staff volunteers and leadership focused on creating a more inclusive environment at RWJ Hamilton for our staff, community, and patients. Held our first Pride flag raising ceremony to observe Pride Month in June. We participated in a system-wide recognition of social justice with a 8-minute, 46-second moment of silence out at the circle, and we hosted powerful conversations for racial equality and social equality forum facilitated by Pastor Joseph E. Woods of Hamilton, which all our employees were open and participated in. From a financial standpoint, that slide looks a little busy, but I just want to say that we have around $19 million, almost $20 million worth of support that we've given to community benefit. And I'm very proud and happy that we can do that for this community. During the COVID pandemic, the height of it, the community came together and was just very, very generous. Bill mentioned this, but by the numbers, the Emergency Relief Fund raised about $199, almost $200,000 came to our hospital to help our employees provide a safe environment to take care of the COVID patients at our hospital. With these funds, we purchased 2 TrueD machines and still have available funding left over. And we're going to be using that also to make sure that we have a safe environment and acquiring additional equipment that will help if we do have a resurgence in the pandemic. We've captured 198 new donors because of this. I'm very proud that we're able to get new people into the door to see what kind of great work we do. And out of that 200,000, about 63,000 of it was just from new people who never gave to this hospital before. And during our first surge, there were more than 40 restaurants donating food. Almost every single day, there was food delivered to our hospital, and businesses donated to fuel our staff and making sure the essential workers were appreciated. And I think they really were appreciated. And I want to thank the folks who donated time and effort to really give thanks to our employees. The municipality, the mayors, Mayor Martin has had a special presentation in July that was really well attended and a flag raising, and very proud of that, as well as the other municipalities of East Windsor and Robbinsville. We had over 2,800 N95 and KN95 masks donated to help keep our team safe for the patients. And the year to date for our foundation, we've raised over $375,000 for the hospital. You can see that it came in all different forms, from the $200,000 from the Emergency Relief Fund. We have a Patient Assistance Fund. We have a navigation fund that the RWJUH Foundation has graciously donated, as well as the holistic program with the We versus C programs that have really donated a time to our care to our cancer patients. I just wanted to give a little commercial for what's going to be happening over the next year. We will be having a number of events, even though they might be virtual. We urge you all to participate. One is the We versus C Beyond the Looking Glass, which is October 23rd, 2020. It's going to be a really fantastic event. I urge all of you to register and become part of it. It will raise funds for our holistic program. Just on Friday, we had over 300 people show up for our young professional group night for Trolls World Tour. And it was a very successful event. I heard very positive things about it. And these are events that the young professional puts on, again, to support our cancer program. And we have a gala in the box on November 6th. Again, a different type of event, even virtual, but it's going to be an exciting event. I hope all of you will participate. And Cash for the Holidays 50-50. So those of you who are betting and want to go back and gamble a little, we have the 50-50 coming up. And we have Running with the Devils and our 5K virtual run walk that's going to be coming up as well. The auxiliary is celebrating its 50th anniversary this year. This is the year they're 50 years old, and so I want to again publicly recognize Carol Holloway and her auxiliary team, who for 50 years has provided support to patients and programs, and is embarking on a complete rebranding next year. Excited for those of you who might be on the call who really want to participate at a different level at the hospital. Please see Diane Grillo, and she will help get you part of our hospital. It's exciting to see them changing with the times and being vital even in 2021. For those of you who want to see our financial statements, you can go online. This is the address. And I will now turn this over to Diane Grillo, who will talk a bit about our community health needs assessment. Thank you.
Thank you, Richard. As you mentioned, I'm Diane Grillo. I'm the VP of Health Promotion, and my job's to be out in this community and make sure that we keep everyone well. So I want to talk a little bit about how do we determine the health needs of this community. So every 3 years, we do a health needs assessment, and then that's called a Community Health Needs Assessment, CHNA, which translates into a CHIP program, which is the Community Health Improvement Plan. So how do we do this? Collaboration and partnership, you'll hear that throughout my presentation, and you heard it a lot, even in Richard's. So we have a partnership with the Greater Mercer Health team that essentially is every hospital in Mercer County, every health officer, and then also Mercer County participates in that. We get together and hire an outside company to help us do collect all the data and help us do a health needs assessment, and we do that every 3 years. So what I'm going to talk about today is what we've done for the and will do through 2021. And actually, this year we are starting to plan the process for the 2022 to 2025. And interestingly enough, with Bill Walsh, thanks to Bill and to Richard, we have several board members who will also participate in this community health needs assessment and gathering and collecting the information. So I'm really excited about what we'll find out. We also land up with information from our physician and our businesses, community members. So it's a pretty robust needs assessment. So you'll hear what we found in the last one that we did. So this is the results of the community health needs assessment in Mercer County. So essentially there were 3 top issues that were identified in the last needs assessment, obesity being number 1, and food insecurity, which is kind of interesting because you would think that they don't tie together, being food insecure and obesity, but they do, because in many of the communities that we work in, what you find is that it's easier for them to get potato chips as opposed to fresh fruits and fresh vegetables, and that leads to the obesity. So it really is an interesting, kind of, I call it a conundrum. So obesity, substance abuse, mental health, those were the top 3. And it really is no surprise. We saw it again like 3 years prior to this, the same thing. To make these changes in a community takes time, takes energy, takes effort, takes partnerships, takes collaboration. So those all the things that we work with. We opened a Quit Center, actually right here in the Wellness Center, with the help of the RWJBarnabas Health Institute for Prevention and Recovery. So there's a lot of services that are available for substance abuse and use. And then in mental health, we have psych screeners. They're available 5 days a week on site, on call coverage in the weekends. We do telepsych in the hospital with a specialist from RWJBarnabas Behavioral Health. And there's always a seamless transfer for our patients to a Barnabas Health facility for a mental health crisis. So we're really excited about some of those. I'm going to talk just briefly, like by the numbers. And so if you take a look at the numbers here, just for the community health improvement, those top 3 issues that we were working on, there were almost 16,000 people whose lives we touched and who we made a difference. When you look at some of the protecting of our community health and wellness, you can see that we moved to virtual this year. So it's going to be a very interesting the way we combine the virtual programs and the on-site programs. And so the fitness center is opened, so we're still going to be welcoming our community in, but in small groups and whatever the governor says. So we can have about 25 people in a room at any given time, and that's where we're going to continue to do our programs. We've done things with Mercer Street Friends, so that's the food bank in Mercer County, and so we've supported them both as a community and then also as employees. And then we started, it's actually 10 years old already, the Kids Fit program. So it's a childhood obesity program where we not only work with the children, but also the parents and their family to really talk about healthy lifestyles, teaching children to make better choices. Because if you start young, you have a better opportunity. All the research has shown to make a difference in children's lives. So Kids Fit program's been hugely successful both in the community and then also from the pediatricians referring their children, because there really isn't any other program out in the community. We're fortunate to have a healthy cooking kitchen, so our dietitians actually teach people, families, how to cook together, how to eat together. The exercise physiologist from the gym comes over and shows them how to exercise and do things both in the home and even things like biking. But we had a family in Kids Fit that couldn't afford a bicycle for their child, and when I mentioned it to one of our employees, we actually got a donation of a bicycle for one of those children. So we have not only a collaborative community, but we have a wonderful group of employees that is extremely generous. So talked a little bit about partnerships and collaboration. I wanted to just highlight this one. This is interesting and this is very new. So we had been working with the College of New Jersey on some of the holistic programs, and they had a real interest. They toured the Cancer Center, and they just fell in love with the concept of holistic medicine and our Cancer Center. So starting this semester, and the class already started, it's a 3-credit course in their music program for students who were participating in the music program, but now they're going to do research in the Cancer Center to see whether or not our patients will gain any type of benefit from actually the music therapy. So it'll be a sort of a research-based program that the College of New Jersey is thrilled with, and we're equally thrilled to be able to offer something as elaborate as that. Who knows, maybe Ryder will pick up after they hear that the College of New Jersey is doing this innovative program with us. So we're excited about that new program. This is still going back on the numbers. So the best way to get to have people stay healthy is to screen. So we hope that even during this COVID crisis that our patients and our community members will get screened, because it's so easy to. The wrong one? Oh, I see. Okay, thank you. Because it's so easy to just ignore something, but when you do a screening, you get a chance to make a difference. I know, like, lung cancer was like one of the #1 killers of women, and people didn't know that, and people didn't know that you don't have any symptoms until oftentimes it's at stage 4 and it's too late to do anything. So our lung navigator in the cancer center is doing screenings, and it really is making a difference. And then lastly, I really wanted to talk about the Farm to Family program. So Farm to Family is a program that it's a partnership and a collaboration between Snipes Farm and Nursery, the hospital, and our community education team, and the Bromley Center over in the Bromley section. So for those of you who know, the Bromley section of Hamilton Township is probably an extremely diverse community and one of the greatest needs that we found. And so when we took a look at the opportunity to deliver farm shares to this community and bring our educators out every week in 16-week growing season to talk about healthy eating, deliver the farm share, and get to know the families and see how we could help. It's made a it's made a tremendous difference in our education piece. But it was an interesting, and I'm going to just end with a story. Actually, it's Tina's story. Oh, by the way, I have a thank you to the WAWA Foundation to help support this program. So Scott Kent was very instrumental in supporting this program as well. So I'm going to just read you something that one of the participants told me. Her name's Tina. She said, "It's a terrible feeling as a mom, but it is a reality. Do you get the medicine? Do you get the fresh food? Do you get the shoes, or do you send them to school in the fall in sandals? Every day is a juggling act. The Farm to Family program made a difference, first in providing farm fresh food, things I never ate for sure, and the recipes helped. In my neighborhood, there isn't many opportunities to have fresh vegetables. During COVID, fruits and vegetables were expensive in the grocery store, and my family needs to eat healthier. This was an opportunity to take advantage of fresh fruits and vegetables and the healthy eating teaching tips. The staff at RWJ Hamilton made me feel important, that they cared. Thanks, RWJ. And from the executive director, the Farming Center is overseen by the CYO. So Pat Hardiman added to that note. And he said that the Bromley Center and the CYO was very fortunate to partner with RWJ Hamilton and Snipes Farm to introduce the Farm to Family project to residents in the Bromley neighborhood who are at the greatest need. The response from the residents, the allotment of fruit and vegetables distributed, and the healthy eating and drinking tips were amazing. This is a true partnership of 3 organizations coming together to battle food insecurity during a rough time. So it really made me feel that we continue to make a difference. And so I thank everyone for in this community that supports us and provides us with the needed things to make this a healthier community. And then, I'm going the wrong way. There we go. And then lastly, I just wanted to end. So you heard Richard mention, this is our 50 years on November 21st. One more? I'm sorry. So this on November 21st, 1971, we moved to the Hamilton community. And so we will be celebrating that throughout the course of the year. If there's anyone in the community that has a story to tell, has something to share with us over our past 50 years and the difference that we've made in this community, I ask them to please call me, and I would like to track all the accomplishments that we've done and the difference that we've made in this community. We're excited about the next 50 years as we continue to promote, preserve, and restore the health of this community. And thank you for listening today. Questions? Do we have any questions? We've unmuted everyone. If you have any questions, Richard is here.
It was a marvelous presentation, Diane. Thank you for that.
Thank you. Hi, Len.
If there's anybody has any questions, you can just, we're not doing a chat, so you can just ask your question. If there's anything you want to know about the community, what we're doing next year, what's happening in the hospital, be happy to answer any questions you might have.
So we can't get hold of them. So we just
Oh, okay. Well, thank you very much, everybody. We appreciate your participation. Have a good day.
All right.